Hello, hello. Thank you for joining us today for our podcast of Talk Rehab to Me. We are so glad that you were able to join us today, and we're going to be having an extra special panel today here at Inova Mount Vernon Rehabilitation, inpatient rehabilitation. And today, we're going to be talking about the dual reality of recovery, exploring daytime motivation and nighttime vulnerability in acute rehabilitation. And I'm going to go ahead and ask our guests to go ahead and introduce themselves. I'll start. I'm Stacy Schaub, Senior Director of Nursing here at Inova Mount Vernon Rehabilitation. And my co-host is...
I'm Dr. Daniel Ampoma, Clinical Nurse Educator for Rehab. It's glad to have you all here.
Hi, happy to be here. Thank you for inviting me. I'm Abby Darlington. I'm the Interim Senior Director over our therapy services at our rehab center.
Hello, and I'm Dr. Epstein. I am one of the neuropsychologists inpatient at Inova Mount Vernon's rehab.
Hello, everyone. I'm Deandra Fortune, the Clinical Director here at one of our inpatient units, 5C.
Hi, I'm Monica Donto. I'm a unit supervisor on Unit 5C at Inova Mount Vernon Hospital.
All right, so today we have a very distinguished panel. And I see Miss Abby is here. We have Dr. Epstein, and we have Miss D. I call her Miss Deandra. And obviously, we also have Miss Monica, and our Senior Director, obviously. That is Miss Stacy Schaub. Let's go straight out and talk about today's topic. And before we do that, Dr. Epstein, can you share just a little bit of an idea? I know you're a neuropsychologist, in the rehab setting. Tell us a little bit about what a neuropsychologist does in rehab.
Yeah, so that's a really good question. So neuropsychology in the rehab setting, for me, I'm doing both traditional neuropsychology, which is testing of cognition, thinking ability, especially after brain injury. So stroke could be brain surgery, could be a traumatic brain injury. And I'm also doing what's called rehabilitation psychology, specifically within the context of these neurological conditions. But I also see some patients that don't have neurological conditions. They could be here for spinal cord injury, motor vehicle accidents. And rehab psychology is really similar to traditional clinical psychotherapy, but the focus is the stressors that surround the medical event and the traumas related to that.
Wow, that's great to know. So let's go to Miss Abby, right? So I know you are in the interim position as, tell us a little bit about your role.
Yes, absolutely.
In rehab.
Oh, thank you. Good question. So my background is occupational therapy. So I started here many moons ago, almost 18 years now, and I actually started as a lonely new grad. So I got to treat the patients that we have on inpatient rehab. So I've worked with all of our diagnoses. We run the gamut here at Mount Vernon. We see anywhere from our neuro population making up almost 50 to 60% of that population, with the rest being your general orthos, debilities, oncology patients, medically complex, essentially. So off of a level 1 trauma, we take it all. So we have a very complex caseload. All that to be said, that's a little bit of my backstory and what I've worked with here at Mount Vernon, and I've kind of worked my way through into leadership, and I'm now sitting as the interim senior director. So my role is to ensure that I'm supporting all teams. I work with our clinical therapy teams, PTOT speech, psychology we partner with, certainly a very close relationship with our nursing partners, our physiatrists, and all of that, case management, all that come together. So that's really my role. I make sure that we are providing excellent care to all of our patients.
All right, so let's go straight to Ms. Deandra, right? Ms. D, I know you're clinical director for one of our rehab units. What is your role?
Well, I have the pleasure of overseeing 44 team members in the nursing department. These are all exceptional team members who bring a lot of love and compassion to the unit. Many of us are certified rehab nurses, and many of us have advanced degrees. And so we take this nursing education and background and we bring quality care to our team, to our patients. It's my job to ensure that the team feels supported, has all of the resources that they need, as well as offering them the psychological safety to come to me if they ever have challenges. It's very important that we offer them, downtime when they need it. And so when they come to the building, they're able to provide that exceptional care. I also have a role in doing face-to-face and bedside care with the patients on a daily basis as well, just to make sure that I stay, within the practice and that I'm up to date in practice. So I remain educated with the team members and then show them that support on the floor. So it's just a really great honor to be the lead of such a wonderful team. They are exceptional in all things they do, and their outcomes show it.
That's very good. So let's go to Ms. Monica. So Ms. Monica, I know you're one of our great frontline nurses and an RN unit supervisor. Tell us in a nutshell, what is your role as an RN unit supervisor? What does it entail?
Well, as a unit supervisor, I'm like an assistant to the director, and I'm a frontline person to the nurses, a resource, making sure that, all the quality initiatives are followed. So with the nurses every day, checking and making sure they are following Innova quality initiatives, making sure that, our patients are receiving excellent care. So my role is to round on patients and families, also to make sure what is going on, if there is any concerns, I'm there to address it. If I have to escalate it, I'm there to make sure that our patients are having excellent experience. So my role is both for the nurses to support my director and also to make sure that our patients are having excellent care.
I am so
on our
glad
unit.
you shared that with us. So we have really quite the panel of professionals here. So I'm going to ask Ms. Deandra, because this is where the idea started. And I think it started with a fabulous farewell. So can you tell us what a fabulous farewell is and how did that spark this?
Absolutely. So a few years ago, our wonderful senior director, Stacy Schaub, encouraged us to do fabulous farewells for our patients as they were leaving the building. She wanted awesome arrivals, fabulous farewells. And we would do these celebrations. We'd give them a thank you letter, we'd do certificates, and we would take videos. Well, we started to note that there was a disparity that emerged between the day and the night shift nursing staff because they perceived the patients very differently. We'd show a video, and the night team would say, "Who is that? I don't even recognize this person." So we realized that the patients were presenting in two different ways. Very motivated and excited during the day, but a lot more vulnerable at night. So we decided to kind of explore some different areas to where we could collaborate with the teams to get them all more in alignment. What's been exciting about this process of sharing the videos and the fabulous farewells is that the night team has grown in appreciation for the work that they do. It's been very obvious in our patient experience over the years. It's obvious in our nurse experience over the years, and a much happier team because they know the impact that they're making.
So, Deandra, you cannot just toss those out there without giving us some numbers. What is your staff satisfaction in our recent survey that we just had?
Yeah, so we were able to do a safety culture and experience with the nursing team, and we scored over 97.5% for a safe and experienced culture.
All right. So thank you, Ms. Deandra and Ms. Monica, for that input. So I want us to go straight and talk a little bit about the topic for today, and it has to do with sleep. Okay. We're looking at sleep and how our patients go through it. What are some of the effects? Because I believe that in 24 hours or as long as someone is at admission, right, sleep is one of the most important things that helps with recovery. So with Ms. Abby and Dr. Epstein, what is the connection between sleep quality and a patient's motivation to participate in therapy? Share your ideas with us.
Yeah, this is a really important question because this drove the quality project. So this poor sleep affects a lot of indirect things that lead to poor motivation, but poor sleep also directly affects the parts of our brain that are in charge of motivation. So a few things really quick. So it affects our ability to recognize errors. We won't recognize when we're performing badly and then make the appropriate redirection, connection to the right strategy. We don't pay attention as well. We don't recognize good performance, which is so important for motivation. If we don't know that we're doing well or improving, why try? So those little things in the brain affect the larger picture of motivation. And then poor sleep also affects our ability to regulate pain. So if we're in a lot of pain, probably don't want to do rehab.
That's true.
Yep. Affects our ability to actually integrate new knowledge and new strategies for our goals. We're more likely to go back on habits, which could be very unsafe in the rehab setting. And of course, as a psychologist, I have to mention that poor sleep affects mood. It's more likely to lead us to feel depressed or anxious, or just in general have a hard time managing the stressors of this setting.
That's excellent. So let's switch to Miss Abby, right? And just wanted to talk a little bit about this. So in your own estimation and in your own thoughts, what are the biggest causes of sleep disturbance, especially in acute rehab setting? What do you think?
Yeah, absolutely. I think something you're going to see probably in a lot of hospital settings is just the disturbances of the environment. We'll start there. Hospitals are not traditionally a most quiet space, right? You have a lot of people coming in and out of the room to offer the great care that we have to offer around the clock to make sure we're keeping you safe. But that, of course, lends to some challenges with making sure we have good sleep. Other things that can impact that is what Dr. Epstein spoke to is your own internal thoughts. Most patients that have come through rehab have experienced some form of major trauma.
Okay.
Right? When you come to us, it's because you're not quite ready to go home. So you either have a physical or a cognitive disability that requires more rehabilitation. That's heavy. That's a lot for our patients to undergo. And something to keep in mind is you have so many factors happening, not only during your recovery that are happening to you in that moment, you're also thinking about your personal life. How am I going to pay my bills?
That's right.
Who's taking my dog out? How's my daughter doing who just had a baby? These are all the factors that we consider as we have a holistic approach, and they all impact sleep.
So, so taking a closer look at the summation that you just brought forward. So in rehab, when a patient comes on, let's say an admission, do we have any plans towards sleep?
Yeah, certainly. And that's where we partner really well across our disciplines to kind of catch those initial identifiers. And that's something we looked at as we did this deeper dive into sleep.
Okay.
And that's something that this is, what we wanted to explore. How can we have interventions proactively to ensure that our patients are getting the right amount of sleep so that when they come to do their therapeutic interventions with therapy and nursing and your physicians and your psychology teams, that you're performing at your best. So that's what we really looked at. And our nursing partners can speak more to those interventions they applied to see how those outcomes looked when it came to participating in our therapy program.
Okay. So for Ms. DeAndre, right, and Ms. Monica, I know we are talking about a topic that is very, very so dear to your heart, and you're looking at sleep and its effect, especially with patients and in the rehab setting. What really motivated your team to come out with this project?
Well, as I said before, we were noticing that there was a disparity in the type of presentations that the patients were having. So there were multiple different factors. It could be the patients were in more pain, less happy. They were maybe communicating less. They were physically a lot more exhausted. And so even when we would have instructions from our therapist on how to do exchange and transfers with them, they couldn't practice it at night. So it was a lot of variable things. what was exciting is when I brought this to Dr. Epstein, she said, well, DeAndre, this is a lot of things to explore.
I like that.
So she said, well, let's dive into one aspect of it. We can't cover everything right now because this is a very broad project. So she honed in on the sleep quality, and we attached that to the fatigue for therapy.
So you know, before you continue, right, hold off on that thought. So, Dr. Epstein, so when Ms. Monica came to you with this project, right, this idea, what was your aha moment on that one?
You mean like how did we get to
What was your
sleep quality?
take on it? Yes.
Yeah. Well, it was a very ambitious project at first, essentially wanting to improve the overall quality and all of the factors that could potentially lead to poor motivation and
Okay.
ability. And so, we wanted to start by honing in on essentially one variable, and seeing can we actually do an intervention with this one variable and see what our outcomes are. And so that one variable that we landed on was sleep quality, which is a common complaint here in the hospital, poor sleep. If anyone's ever slept in a hospital, you may also have personal experience here. So the hospital's not where you come to get good sleep, but it's so important for recovery. So, DeAndre and I realized, hey, this is an area that we need more intervention that could really make a big difference for our patients.
Okay. So, Ms. D, let's come back to you.
Yes.
Continue with your thoughts.
So to exactly her point, she said, let's narrow this down. Let's make it focused, because from a nursing intervention, we can have so many different things that we try, but if it's not focused, if it's not, if it's not a SMART goal, then we really don't know if there's any results that were really
Right.
effective. So then we collaborated with Abby. And at the time, Abby was the, instead of the interim senior director, she was the director of the rehab services. And so she worked with us and found a way to connect the fatigue for the therapist notes. And we used an actual resource of our computer, our Epic and EMR, to
Okay.
take notes and connect the two. If a team member or a therapist documented that a patient had lost minutes due to fatigue, that would trigger us to say, well, let's look into the quality of their sleep. And then we would bring the nursing team in to take a, diagnosis or deeper dive into what were the causes of it, using some already established tools out there,
Okay.
the Pittsburgh Sleep Tool.
Right.
Yeah, the Pittsburgh Sleep Quality Index, which is the gold standard for assessing sleep quality. And then we also looked at the missed minutes in Epic. Missed minutes, essentially, what minutes of therapy are our patients missing? And we looked at specifically due to fatigue.
And so we could narrow it down a little bit more if the therapy session was in the morning, right? Because if it happens at 3 p.m., that might be due to the previous sessions that they had. So we wanted to make this, once again, very targeted and very smart. So we focused on the morning sessions that were missed, and then we would incorporate our nursing team to interview that patient. What was exciting is the patients then really expressed their individual needs, and some of those causative factors, pain, it could be their medications, it could be noise. It was a very different variable things that were
Right.
causing sleep quality disturbances, and we developed a plan that we could click on certain different aspects of how we could intervene as a nursing team to address those specific concerns.
Okay. So, with that said, right, Ms. Monica, being the RN unit supervisor, I know that especially for nursing, right, we have two phases of nursing. We have day shift nursing and we also have night shift nursing. So with this project, so let's talk a little bit about the impact of this project on the various shifts. So my question for you is that how many patients per day or night complain about poor sleep? Any idea? Any idea?
I would say during my rounding, maybe about 3 or 4 patients complain about not having enough sleep. So, we have to individualize care for each patient. What keeps patient A awake is different from what keeps patient B awake. So we sit down with them and we interview them to know exactly, what causes their insomnia. So most of the concerns of patients is sometimes, multiple entry into their rooms. The nurse came in to give medications, and then the clinic tech came to do vital science, and there comes the lab lady also to draw lab. And this is within like 4 hours of their sleep, within their sleeping time. So we noticed that this really can impact, how much sleep the patients are getting. And if they don't sleep well, it's going to impact their motivation.
So is it like, are we messing up their sleep?
Yes, we are. And there are times, maybe unknowingly, the nurse will go in the room, give medications, and leave the lights on. And that could keep the patient awake. And some patients are very sensitive to environmental, stuff like call bells.
That's correct, yes.
Recently, we had a patient with mild dementia, and with every call bell, call light, the patient will scream. So just imagine how much sleep this patient will get.
Right.
So as nurses, we are with these patients 24 hours, both during the day and the night. So, we monitor, we assess the patient, and then we will have to work with the team how best we can help our patients sleep. So we bring these issues to huddles, and we discuss with the team. We need to cluster activities, instead of the nurse going in this time, the tech coming in this time, going together, do it at one time. Patients who don't have any, labs that are really important, we want their lab drawn after 6 o'clock, which would not,
So that gives them more time to do that.
Yeah, it will give them more time to sleep. And also, we ask, we talk to our physicians. Sometimes they will need a sleep aid or something that could help them to sleep. We give earbuds, eye covering, something to help our patients to get enough sleep. Because sleeping is part of life. And, without sleep, they cannot really do well in therapy.
Exactly. So let me do this. Let's go to Miss Abby, right? So when we think about physical rehabilitation, we think of regaining independence. How does sleep affect rehab from your perspective?
Yeah.
And also kind of considering the project.
Yes, absolutely. I think sleep affects us as humans in general, right? It's so vital to the way we function. I got 3 young kiddos, and I can tell you those newborn phases, I was a very different person during the day when I was coming out of those newborn phases, right? So I think about our patients who are already vulnerable. They're already in medical crisis for many of them. So that was a big impact. And that's where we partnered really closely looking into this study to say, how do we look at these individualized care? How do we collaborate across therapy and nursing and psychology to say, we've identified these concerns and issues. What is the unique plan of care for this patient to try to see if we can reduce any time away from therapy during the daytime so they can't lose any valuable progression? We know that inpatient rehab it's a short stay, high intensity, high frequency, but you're here about the average of 2 weeks, and we want to make every minute count.
Oh, I like that. Every minute counts.
Yes.
That's fabulous, Abby. So, Deandra and Monica, I know you're just 2 of our very many certified nurses here at Inova Mount Vernon Acute Inpatient Rehabilitation. When people think about inpatient rehab, they're often thinking about therapy. But nursing is, as you said, 24/7. So from all the outcomes and the research, Deandra, that you and your team were able to accomplish, what were some ideas and some things you were able to do to help our patients in the evening hours and the day shift hours?
Well, first I want to explain that even though it has sounded a little bit simple in our previous discussions about clustering care, we wanted to first establish a baseline understanding of the nursing staff and how they really felt about sleep quality. And they did understand that there was some influence on how well the patients did, but they recognized at that time that their care practices were a lot more reactive versus preventative. So that portion of the study was earlier in the study. Okay, cluster care, let's do a little bit better job with reducing the noise factors. But then some of the, patients had additional disturbances. They were patients that were spinal cord injuries that needed to be turned and repositioned. So yes, you're getting cluster care because we're coming in as a team, but you have to get it every 2 to 3 hours. Can we do anything effectively to reduce your the risk of you acquiring a pressure injury? Some of them were having, medications such as pain medications that wore off at a certain time of the night, and that would wake them up in excruciating pain. So yes, as an overall theme, we did improve our practices for reducing disturbances, but for many of our patients, we still had to be a lot more specific. And for the ones that we could not change things for, we couldn't, not turn them. Just the simple fact that we cared enough to talk to them or discuss it. The simple fact, like Monica said, maybe a sleep aid that we would offer not as the scheduled 9 o'clock, but they wanted it at 11 p.m. was a much better fit for them. Scheduling pain medicines to go with other, on top of some other type of pharmacological intervention at a different time of the day. So they would just understand that we were listening to them and paying attention to their patterns. So not only did we improve as a whole, but then we were able to still narrow it down to some more specific interventions.
All right. So to our audience, this very afternoon, we're talking rehab to me. And this is our third episode. And today's discussion, we're trying to hammer out what are some of the effects of what? Of sleep on our patients who come to rehab. And we have a distinguished panel today giving us very good ideas on a project that they had done. We have with us Ms. Abby Darlington. We also have Dr. Epstein. We have the Ms. DeAndrea Fortin, and we also have Ms. Monica Donto. And we have our Senior Director for Nursing, my own Stacey Sharp. All right. So before we move on, Ms. Abby, I want you to think about this. How do missed minutes affect therapy progress, considering the project that we went through?
Yes, absolutely. This was what we were really keying in on, is did we see a reduction in missed therapy time as a result of some of the interventions we applied around sleep quality? And we did. Those patients were able to participate in their therapy minutes. And then that really in turn resulted in those patients making better progress. They were able to get back to the community and to their home at a higher level of function.
That sounds very, very, very good. So to our nursing team, right? So think about this too. How can nurses lead the way in improving sleep and rehab outcomes? Any ideas?
It's very important that we recognize, sleep disturbance early. And so we can, come up with a plan of care for the patient. We evaluate where the source is. If we know the source, then we can treat it. And it takes the team. We collaborate with all the team to be able to take care of our patient. And we develop a plan of care also to help the patient. We have, we also encourage healthy habits. Like sometimes we have patients who have dementia, and so we have to differentiate day and night, making sure that, during the day, they know it's daytime, we are exposing the daylight to them, and then nighttime, they know that it's nighttime, so they can sleep. Yeah, so, these little healthy habits also help our patients to be able to sleep. And like Miss Abby said, when you have good sleep, you are able to focus, you have more motivation to do therapy, and the more therapy you do, moving your arms, moving your limbs, moving forward, I always tell the patient, every step you take, those are victory steps.
That's
so
right.
If we don't get those victory steps, you don't get better.
But you know something? Seriously, I love the victory steps you brought in there.
And it delays the length of stay. So once they are motivated to do their therapies, then they can go home, on time.
Very good. So before we wrap up, right, I want the four of you to share a few things with our audience. And this is a question that I just want your own ideas on it. Everybody's going to share your thoughts on it. If recovery truly happens 24 hours a day, how can healthcare teams ensure that the hours patients spend sleeping receive as much attention as the hours they spend in therapy? So who wants to take this one first? Who wants to go? All right, so let's go to Dr. Epstein. Dr. Epstein, that's for you.
Yeah, no, this is really important because, when people come to rehab, I think we focus a lot on the daytime hours, and the team, the staff, we ignore, and not intentionally, but we don't give as much attention, let's say, to the night shift. But the patients, they really, they're still here and they're still being affected by the night shift. And so it's so important that we recognize that as a team and we integrate the night shift nurses into that care. One of the outcomes of this study that we found was when we put more attention into our patients' sleep, they felt a stronger bond with us. We increased rapport, and that was an unintended finding of the study. They were so grateful that we simply listened to them, and that led to the night shift nurses feeling more connected to the patient and their journey, and the patients feeling more connected to the nurses and the team for listening. So it's so important that we simply listen to our patients and we show them, hey, we care. We want to solve this together.
That's right. Wow. Dr. E, that was very good. So, Ms. Abby, what are your thoughts?
Yes, I think one thing this study really showed is, and I'll kind of reiterate what you said, is the importance of collaboration.
Mm-hmm.
As Dr. E noted, some of the team's not here during the night, but care doesn't stop. And we have to make sure we have that good connection between our teams. And one thing we really partner well with our nursing team is when we come in the morning, tell us the story. Tell us the last 12 hours. What do we not know? What do I need to know? So that as the therapy team comes in to do a session, we have all the key important items. And we actually have a strategy we call Tell Me 3. You tell me 3 things that happened, and I'll tell you 3 things that happened. And the nurses will hand off to us and say, and part of that is sleep.
That's
How
right.
did they do last night? Because that's vital. I might change up my therapy session because I'm like, oh, you're a little tired today. Let's try. We're not going to do the stairs at 8 a.m. Maybe we're going to do some like leg kicks to start, right? We might modify our sessions based on the great handoff from our nursing team. Yeah.
Wow. That is a good one. I like the Tell Me 3 that you brought along in here. So I'm going to remember that. Yeah. Tell Me 3. Yeah. All right, to our nursing team. So to Ms. Deandra, your thoughts on that, on the topic? For obviously the question.
Well, for me, what was most valuable about the study, and in particularly the patient-centered aspect of it, is I really want people to remember, especially our nursing team and our interdisciplinary team, that the moment the day is over at the 5 p.m., that is really when patients really feel like they become a patient in my head, right? You have a team of people around you, you have family members, you have stuff going on all day long, and it's not up until that moment you realize you can't go home and go to your own bed when you may feel like a patient for the first time that
That's
day.
right.
So I just want the team to continue to remember to be, aware, compassionate, that these different aspects come into play at night, and that we just make it patient-centered in our goal to get our patients home in a timely fashion, to make them comfortable and appreciate that the time they spent with us was moving forward.
That's good. Ms. Monica, your perspective.
All right. So for me, I think that as a team, patients are vulnerable sometimes when they are with us. So if a patient is going through something and the team does not take the time to assess that and find out how best we can help this patient, they can be here for 2 weeks, they can be here for 3 weeks or more, and may not achieve the goal that they came here for because we were not attentive enough to their needs. So it takes each and every one of us as a team to really, be attentive to the needs of our patients. And one of the most important things is sleep.
So I just wanted to thank everyone for coming together. I think as a senior director of nursing, one thing that I'm most proud about is when we talk about a plan of care and that it's individualized, that's something that all of my nurses do, all of our therapists do, and it all comes together. So I think we have a lot of memorable things to take. Yes, so we have Tell Me 3, we have victory steps, and what time do you become a patient? 5 o'clock in the evening. So thank you everyone for joining us for Talk Rehab to Me, and we'll be looking for you to listen to the next one. Thanks.